Good morning, Shamim. My name is Maria. I am one of the interviewer doing the interview for you. So, how are you today?
Hi, good morning, Maria. I'm fine, thank you. How are you?
I'm actually good. Thank you for asking. So, before we start, would you like to get a drink or something?
Oh, that's all right. Thank you, Maria.
All right. So, can you please tell me a little bit about yourself?
Yes. Yes, I am Shamim. I am doing Bachelor in Nursing in Western Sydney University, Parramatta campus. And I have been working as AIN in Opal Healthcare. It's near about 7 years. And I am at the end of my study. This is my 3rd semester. At this moment, I am looking for a new grad RN position. That's why I'm here, Maria.
Oh, that is actually really nice. So, you ready for your interview questions, Shamim?
Yes, Maria.
All right. So the first question is, considering the NMBA standards for practice that govern your nursing practice, how will you deal with the situation? The following scenario. It is your first rotation as a new graduate nurse in the emergency department, and you have been allocated to look after a patient at high risk of self-harm. He wants to go to the toilet but refuses to have someone with him at all times. He was becoming agitated with you. How would you handle the situation? Reflect on how you would handle the stress of the job.
Okay, thank you, Maria. I know I have to deal with difficult patients throughout my nursing career. And it's my responsibility to deal with difficult patients by showing respect, being patient, and responding to their need. It is also my responsibility to ensure a safe environment to the patient, to me, and to the other staffs. As a new grad, to deal effectively with this situation, I will involve my supervisor. In this scenario, I will keep myself calm and decide my task. It would be a good idea to involve my coworkers for preparation of any adverse situation if it arises. What I will do at first, I will go to the patient, introduce myself, and reassure him that I am here to help him or her. I'll be respectful to the patient by talking in a calm and quiet voice. Like I can say, you seem anxious. Maybe we can talk a little bit about what's happening. That can make things a little bit better. I will listen to him or her empathetically, which will help to build trust. In order to create comfortable environment, I will offer a drink of water or any other kind of juice or anything, and ask if there is any family member or friend you would like to talk. I think this can prevent the situation from getting worse. If he or she comes down, then I will try to find out why he doesn't want anyone to be with him. I will patiently explain to him the reason why someone needs to be with him, and I will assure him that he is in a safe place. I hope by doing this, I'll be able to make the patient calm, and I'll be able to prevent further deterioration. If the situation gets worse, I will involve the security guard to get the help. I think this example illustrates my ability to practice following the Nursing and Midwifery Board of Australia standards. In terms of stress, I can say that I need to be aware of my own feeling when caring for a person who is aggressive or violent. I will arrange debriefing for myself or any other colleagues who are involved in the situation. And this I can do after consultation with a clinical supervisor or an employee assistance service counselor.
That was actually a really good answer. I'm sure you will be able to handle this situation perfectly fine.
Thank you, Maria.
So my next question is, nurses have to comply with occupational health and safety standards. Describe a time you had to deal with an unsafe situation and what actions did you take?
Okay. Okay. As a nurse, it's my responsibility to adhere to the occupational health and safety standards. Regarding an unsafe situation, I can remember one scenario in my workplace where I have been working as an EIN for 3 years. I am working in an aged care facility. One day at the beginning of my afternoon shift, me and my colleague were ready to transfer one resident from chair to the toilet using the standing lifter. When we were transferring the patient, I noticed that I had to push harder to move the lifter, which was unsafe for me and for my resident. I used another lifter instead of using the faulty one. I kept the faulty lifter in the storeroom and put a note on the lifter mentioning that it is out of order so that no one can use it before fixing the problem. I had to report it to the RN in charge and make a note on the maintenance folder. The RN then informed to the maintenance section and they found that one of the wheels of the lifter was not working properly. Eventually, the old lifter was replaced by a new lifter. Later on, my work was appraised by the Work Health and Safety Committee. By doing so, I was able to prevent workplace injury and maintain safety of my resident and other staffs. I think this example illustrates my capacity to comply with the occupational health and safety standards.
Yeah, that was actually good because it is always, it's always really important to make sure that you and people around you are safe.
Yes, Maria.
Yeah. So the last and final question is, the completion of your bachelor's degree is only the foundation of your development as a professional nurse. Ahead of you, there is a lifelong of learning and autonomy. After obtaining employment, what is your short term within the next 6 months to 1 year and long term within 2 to 5 years career plan or commitment to professional development?
Okay. Yeah. I know nursing is a continuous learning profession, and it is important to have a commitment to the professional development to be competent nurse. As a new grad, my short-term career goal is to adhere myself within the NMB standard and develop myself with high levels of professional integrity. I know I have to rotate through different departments in new grad program. This will give me an opportunity to learn different areas of nursing. Throughout my new grad program, I'll try to be competent in basic nursing skills, which I learned during my Bachelor in Nursing course. To improve myself, I will engage in different CPD activities like workshop, seminar, and different online learning program. This will help me to learn the most recent clinical treatment, procedures, practice, And by engaging myself in different CPD activities, I'll be able to provide evidence-based, patient-centered care. In terms of long-term career plan, I know that I have a passion for child health. I want to study further. I want to specialize in pediatric nursing once I complete the new grad program. At this moment, I don't know what is the exact pathway to be a pediatric specialist nurse. I will research more and focus on it after getting the employment. Yes, so that was the answer of my third question, Maria.
So that was actually a really good plan, I think. Concentrate on more basic nursing while you can, and and start doing your dream job once you're ready.
Yes.
Yeah, it takes a little bit courage for someone to work in a pediatric section, because it's all about kids, and I love kids so much, and I can't see them hurting. So
yeah. So that's my passion actually, to work in child health. Yes. Yeah.
that's really beautiful. Thank you so much for doing this interview. It would be it's such a pleasure to see you as a registered nurse once you finish your Bachelor of Nursing, and best of luck with your new grad position.
Yeah. Thank you, Maria.
All right, all good.